All right, it's 10:33. We'll go ahead and get started. So again, my name is Jason Hennessy. I'm with Burke Consulting, and I just want to welcome you to the Department of Early Learning 2016 Early Support for Infants and Toddlers Cost Study. And this is for the local lead agency and provider survey. Let's go ahead and get started. Just real quick, what we're going to cover today. First, we'll do introductions. We'll talk a little bit about how this webinar will work. Then we'll get into the background and purpose for the survey. Then we'll be actually talking about the instrument itself and walk through it. We'll talk about how technical assistance will happen, and then at the end we'll talk about any next steps and kind of a timeline. So with that, like I said, my name is Jason Hennessy. I am an associate here at Burke Consulting, and I am the project manager on this. I'm joined by Annie Sauerwein.
Good morning, all.
She is a senior associate here at Burke Consulting, and she is providing a lot of great assistance here. Also on the line we have from Dell, we have Adrian O'Brien, Lori Thomas, and Debbie Donlin. They are here not only to listen, but also to answer questions as they come up. And in case yours is live, Adrian, if you guys want to say hi, please feel free. But GoToWebinar is saying that your audio isn't working yet. So.
Can you hear me?
Oh yeah. Hey.
Okay, good. I tried to enter my PIN and it didn't seem like it was working, but maybe it did.
It did.
Great. I'm here with Adrian. Go ahead.
This is Lori. Can you hear me?
Yep.
Yes.
Yeah, this is Debbie, but that's my title is actually different than that. Assistant Administrator for Training and Technical Assistance.
Oh, sorry about that, Debbie.
That's my fault.
We'll get that corrected in the slide deck. But first, quickly, we want to talk a little bit about the webinar this morning. So we are using a product called GoToWebinar for this meeting, and we've done that just to facilitate a great conversation where we can provide some information without too many interruptions, but also have some interaction where needed to answer your questions. Remember that webinars are not conference calls, so you all can hear us, but we can't hear you. So if you do have a question, please enter your question in the chat or question function. We're tracking incoming questions, and we'll be providing answers via audio or via chat, depending on the question's relevance to the overall participants. We recognize that responding to some of these questions might require more consultation than we can give on this call. If you have a question that we can't answer during the webinar, we'll let you know that. We'll follow up after the webinar with a response to you. In case you haven't used GoToWebinar before, we're going to give you a quick overview of your control panel. You can collapse it by using the orange arrow. There's a blue button with a box in the grab tab that will allow you to view the webinar in full screen. And then the mute and hand raise functions are disabled for this webinar and will not appear. But you can use your chat and question function. So if you do have a question, please type that in. We have a staff member here standing by to direct those questions to us so that we can answer them as we go. It does sound like we've gotten some feedback that there's some trouble with the audio. If you're having that problem and you could let us know via chat, that'd be really helpful. We've only heard it from one person so far, but we'll do our best to make sure that you can hear us clearly. We've also got a question about materials for the webinar. So you should be able to see our slide deck up on your screen right now. Please let us know if you can't see our slide deck. After this webinar, we will be sending out a recording of the webinar and the slide deck for your perusal and future use as you complete the survey. And you should have received an email from us here at Burke Consulting this morning with the final survey instrument. So you should have in your email a copy of the final survey instrument. If you do not have a copy of that instrument and you've checked your email and you don't see that email from around 10 o'clock this morning, please let us know via chat and we will follow up with you directly. So one more slide on our webinar participation. There is an audio pane so you can switch between your telephone or mic and speakers. Again, we will have to unmute you if you do have a question you'd like to ask on the webinar, and we will facilitate that via the questions pane and the chat function. To submit a question or comment, you can maximize the questions portion of the pane, which you can see here. and type your message and click the send button. You can also use the chat function. That's totally fine. We are, as I said, monitoring those questions as they come in, and we may, pause and answer some of those as we go. So to give you a little background on what we're doing this morning, Senate Bill 5879 required that the Department of Early Learning and the Office of the Superintendent of Public Instruction, OSPI, provide a full accounting for the ESIP program for 2014 and 2015. OSPI has been collecting that information from the school districts. They sent out a survey instrument to those school districts in August. And Dell is charged with collecting the information from you, the ESIP local lead agencies and service providers. To support this, Dell is contracted with us here at Burke Consulting to administer a short survey around your overall ESIP activities and services. You may remember that in 2011, we were contracted to do a similar survey and develop an initial 2011 cost study, which is the document that's being updated right now with some modifications and improvements for usefulness in program planning.
So also, sorry, just to take a quick pause there, it seems like maybe some people can't see the slides. We are sharing the screen. If that's true, I'm trying to think of the best thing to do for that.
If you can't see our slides, the best thing to do would be to check, make sure that you've selected the GoToWebinar item as the top item that you're looking at, and close other items that you may have open. The GoToWebinar tab at the bottom of your screen should have a blue flower-looking icon, and it should say GoToWebinar. And if you select that, your control panel and our screen should pop up. Right now, the screen we're looking at is a white slide with a green line across it, and it says Background ESIP Cost Study, and then there's some other text. So we're going to give folks a minute here to see if they can get that screen up. If you're still having trouble, please let us know via the chat function, and we will try to support you individually.
Yeah, so the email with the survey came out, actually I think it may have been about 10:15 or so. So if you didn't receive that, go ahead and just send us an email at the end of this. We will actually be doing a live demo of the tool, so it's not imperative that you have it in front of you right now, because we will pull it up here. We do want to make sure that everybody gets a copy, of course, but for the next hour, we'll just use the one on our screen, and then we'll make sure that everybody gets it afterwards. I think we can go ahead and.
Great. So it looks like folks can see the slides. So if you are having trouble, let us know via chat. But we're going to continue through the presentation. So what we're doing today is we developed a local lead agency and provider survey instrument. It's really designed to help answer this charge that the legislature has given to Dell. And it's designed to collect three things. One is your full cost of delivering ESIP services during the 2014 and 2015 fiscal years. Two is the funding available to support your delivery of ESIP services. And then three is some qualitative information around your organization, the services you deliver, and barriers to additional funding for ESIP services. What we're doing with this information is evaluating opportunities to improve the ESIP program, allowing us to serve more children statewide. So really the purpose is to get the best information we can to understand how the program is currently operating and what the opportunities are to improve that program. And there's a lot of things that could mean. I think one of the things that we anticipate seeing are whether the currently available funds are matching up to the full cost of delivering services. And I think, we have some preliminary information from folks that tells us that they may not be. And so those are the kinds of things we're hoping to learn. But, we definitely want to hear all of the things that you have to say about how to make the program better, and if you see barriers. So if you have additional information to share, there are some qualitative opportunities to do that in the survey, and we'll look at those as we go through the tool. So quickly, we do have our project schedule up on the screen. I'm not going to look at we're not going to talk about this in too much detail, but I do want to show you that we're working on this project on a rather short timeline. So we were contracted and started working with Dell at the beginning of September, and we've spent the last 2 weeks developing this survey instrument that we're going to walk through today. During that time, we had the wonderful opportunity of working with a local lead agency and some providers to kind of beta test that survey and to walk through the instrument and see if there was ways to improve it and make it more usable and user-friendly. We've also, during that time, developed an incentive for participation. So I do want to remind folks that there is an incentive to participate in this survey. Not only will you be supporting great work in the state to improve the ESIP program, which is highly valuable and it's something that only you all can provide, but you'll also, for the first 50 respondents, receive a $200 gift card to Brooks Publishing, which provides educational materials. And what we've heard is that gift card will be really useful and allow you to buy some actual curriculum and materials that you might use in your work overall. We have released a survey today, so you should have received that at 10:15. Again, if you didn't receive it, please let us know via chat and provide your email and your organization, and we're tracking those, and we'll follow up with you directly. Today is also our technical assistance webinar, which is the call that you're on right now. We are recording this presentation, and we will be sending out the recording and our slide deck. So that's a resource that you'll have at your disposal as you continue to complete your survey. And then we also have a 4-week window for survey completion, and we've really made an effort to make the survey as quick and painless as possible, but we are asking you for some really important information, and so I do think that it will take a little bit of time to complete it. So just be prepared that you probably will spend an hour or two on this survey, and we really appreciate that time that you're spending on it. Over that 4-week period, we will be providing technical assistance. So Adrienne O'Brien, who you heard introduce herself earlier in the call, is our lead for technical assistance, and you can reach out to her directly. Her email is provided in the tool on a couple different pages, and I think you've received it via email already. So if you have any problem completing the survey, please don't hesitate to reach out to us. We are doing the best we can to ensure a really robust response rate on the survey, and part of that is making sure that any questions that folks may have are answered, and that you have the resources you need truly to do the survey efficiently.
Great. Okay. So today we're going to just get a little bit oriented to the instrument itself. We just want to make sure that we have a shared understanding of the purpose and the benefits and the process for completing this survey. We are going to be doing a live demonstration of the survey instrument here in just a moment. And as Annie mentioned, we are recording it, and we are going to be getting a link out to that recording by the end of the day on Wednesday. It takes us a little bit of time to process the audio file, but as soon as it is ready, we will send that out. So without further ado, we'll go ahead and switch over to the instrument itself. So this is it. It is an Excel spreadsheet and will open in Excel. However, it's been designed to look and feel more like kind of a SurveyMonkey web survey, if you're familiar with those. For the purposes of today, I have a feeling that our screen's probably appearing a little small, so I'm going to zoom in. It does best on your computer if it's displaying at 100%. I just want to, which you can see down in the bottom corner. That's where the percent will tell you the display size. So in the beginning here, it should open on the very first page. It is printable if you want to see it all at once, or if you want to take a copy of it with meetings, but it needs to be filled out electronically. A lot of the information that we just covered is mentioned here about why we're doing this and what it's all going to be used for, and that incentive that Annie mentioned. There's also a link to the 2011 study if you'd like to see how the information was used previously. We are hoping that this is an iteration of that, but also an improvement. So we are hoping to get even further along in the process than we did then, better information. On this first page, there's just some beginning information about who you are you a local lead agency, and just some contact information. Now, the reason why this is here is because there are pieces of the survey that respond to how you provide this information, to the information you provide here. So, for example, if you're not a local lead agency, there are some things that aren't applicable, and so they turn off, and vice versa. If you are, there are some things that turn on. That's true throughout. It'll continue to track the information that you've entered and try to curtail the unnecessary questions. We just want to make this as fast as possible. There is also a link to Adrian's email here. If you need assistance, you can click on it. It should open in your email account. You'll see throughout we have a navigation. Most of them are up on the top where you can click these arrows. It'll take you to the next screen. It will take you to the next place that you can fill out, but it's not perfect. It might need a little bit of an adjustment. So here we are on the second page, and this is really what we call the home page. This is sort of the center of the survey, and you can see it all at once. There are some instructions here. Again, there's another link for help. You can see that already this is the first place where the information is going to respond to your first question. So I'm going to go ahead and say that I am not an LLA. And so now when I go to the next, I need to slide over, you can see that it says that I've indicated that I am an ESIT provider because everyone who received this was either a provider, an LLA, or both. And so it's telling me a little bit about what information I should provide and how to think about this survey. For both the LLAs and the providers, we're asking that you give the data for your entire operations concerning ESIT, not just your role as an LLA if you are one or as a provider, but everything that you do that concerns ESIT. That's the information we're trying to gather here. Like I said, there's just a quick set of instructions here. I think one thing I'd really like to highlight is that we have made it consistent throughout this entire survey that we have made it consistent that there's a white cells are the place that you will enter your text. So any place that you see a white cell, that's where we're asking for a response. And this survey also, we would hope that if you can, that you fill out every cell that's white. It would be much better than having blanks to have zeros if the answer is 0. We understand that also it can get a little tedious typing that in every time, but we are hopeful that that way we can tell what's a true 0 versus what's just a blank. And we have ran into that before where it's difficult to tell. Down here, we actually have an overview of the entire survey. So this, you can see that there are 15 pages total. That includes the 2 pages that we just, well, the first one we went through and the one we're on now. There is some information provided on all of these. However, there's a significant amount of white space on these. So it's not, 15 sounds maybe like a lot, but it's not too bad. It is comprehensive, but we're hoping that it's not burdensome. These are live links, so if you come back and you want to start someplace where you were before, you can go ahead and jump to that section. I'm going to go ahead and use it just to move to the next one, general information. Now again, you can see what it's doing is it's taking you to the first cell that you can actually enter information in, and it doesn't always line up perfectly, so you may have to scroll just a little bit. This first cell here will pull from the first page. So as soon as we enter, and actually let me go ahead and do that. I will say that I work for Burke Consulting. And we'll just put in a little bit of information. It is easiest to move through this by hitting enter.
And quickly, one thing to mention as Jason fills that in is the only reason we're asking for respondent information is so that we can follow up with you if there's anything in your survey that we have questions about. So this isn't even intended to be about accountability. It's just about who filled this out so that if we do have a question, we can reach back out to you. We'd appreciate if you'd provide your full name and your title just to make it easier for us to connect with the right person. I think we all know places where there's lots of Laurens or lots of Michelles or lots of Michaels. So if you could provide your name, it's really just to help us if we have questions about your survey, and it's not something we're going to track in the long term or hold you accountable for any of your responses, other than to follow up where there's questions.
And that's a great point. I just want to hit upon that. We won't be using your name or your title for anything other than to contact you. That's not in any way included in the final report. That's just for us to get in touch with you for questions. We're not tracking you or anyone. So the same thing here. We can just go ahead and skip through. So one thing that's kind of important here, every organization has its own fiscal year. For a lot of people, it's the calendar year. For the state, it begins on July 1st and runs through June 30th. The Senate, when it passed this bill, was very specific, and it asked for this in terms of school years. It does. We have heard that some people make it seems like it makes it feel kind of school district centric, but that was how the language appeared in the bill itself. So we're doing our best to try to work with the information that you have available to you, but also be true to what the legislature has asked.
And, one thing to mention is we did work with some beta testers to determine what information you might have available to you, and we're going to walk through what's requested in the tool. But if you find, as you're going through the survey, that we're asking for something that maybe you don't have available to you, that would be a great time to reach out to Adrienne for some technical assistance, and we can find a way to figure out how to work with you to get the right information. Part of what we're going to learn throughout this process is the availability of the data we're trying to collect, and maybe some ways to improve that in the future. So it'd be great to hear that, and rather than just not responding, it'd be wonderful to hear from you so that we can support you in responding in the way that makes the most sense to you. Because we do recognize that not everyone tracks their fiscal information the same way.
So let's say that I use a calendar year for my fiscal year. So it begins on January 1. And it ends on December 31st. One feature that you'll see consistently throughout this survey is that there are drop-down menus. You can tell that there's a drop-down menu when you select a cell and there's this little arrow. You can still type in there, but it's going to say, like, let's say I say something ambiguous, like maybe. It's going to say, this value doesn't match what's required in this cell, and I can retry. So here I can go ahead and delete out what I put in, and the drop-down menu is being a little funny. There we go. And I'll say, yes, my organization does provide direct ESIT services, and we also contract. Now, before I select that, I just want to point out, so this area here to the right is currently blank. If you do contract, obviously there's some more information that we're going to be asking for about those contractors. So if I select yes, a new place opens up for me to enter that information. This question about electronic records for children and services annually, in addition to the data management system, is for future data requests as we start moving forward. And if this process gets repeated, it will be easier to, what's the word I'm looking for, to integrate with the systems that you already have versus going through a one-off tool like this every time. So this won't change anything. This is more just for background, so I'm going to say yes. For fiscal year 2014, so whatever year you use, how many children did you serve? Or excuse me, how many children did you screen for ESIT eligibility? I'm tripping over my words today.
And some of the reason, again, for these qualitative questions is because we want to be able to compare apples to apples between organizations, and we need to understand a little bit about how your organizations operate. One of the things we learned during the beta test is that screening actually can be a pretty sizable cost. We talked to an organization that screens something like 300 children a year, or a month.
A month, yeah. And
only 90 of those children or so a little bit less than 33% or a third, actually get ISSPs and become children that are being served by ESIT at that organization. And so what we recognize is that there's a pretty significant cost associated with screening that we want to make sure that we're capturing and understanding completely. So that's the reason for some of these more qualitative questions where we're answering. It isn't the answers themselves aren't necessarily something we're tracking. It's understanding the organizations in context and compared to one another.
So let's say I screen 1,000 children. You'll notice that both of these have a comment field that is completely optional. If you want to say anything in here, like, you know, we use a Microsoft database or something, and then maybe we could say that even if you want to include some qualitative information, like 2014 was a low year, lower than normal, probably actually a better. And then down here, we're asking that you just kind of give a description of your organization. So for example, ESIT may be the primary thing that you do, or maybe you provide services through all age groups, or maybe just young children, but beyond age 3. We're just hoping that maybe here you can kind of provide a little bit of an overview, anything you'd like us to know. So one thing that you will see throughout this survey is that we have used color to try to navigate through which year we're talking about. So 2014, we've used purple. So every time that you see purple, the question is referring to 2014. So here for the contractors, it's asking who did I contract with in fiscal year 2014. So I'm just going to put in some dummy information in here. Now what happens, I'm going to put in some more, but you can see that this feeds through. So my name, my organization's name has appeared here. Spaces have now opened up for all the contractors that I've entered. I'm going to go ahead and add some more. 7 is the magic number. Okay. So now they've all fed through, there's places open. We're now on a services provided, and I guess I'm not being very good about using we can use the arrows to navigate through. Again, it takes me to the very first place. All of these are yes, no. So did my organization provide service coordination? Now for this particular section, this is, did I give children, or did I provide this service to children directly, as opposed to contracting for it, because I'm going to say what my contractors do down here. So I'll say that AA does that, but DB does not, that I definitely do, and so on and so forth. You can get a little bit faster with, once you've entered a couple of them, you can just put in the first letter and it should auto-complete for you, but it won't do that on the very first round. So you can either use a drop-down or type them in, and this is the part where we are asking that if you could, if nothing else, please put in the yeses everywhere, but if you could put in the no's, that would be wonderful. Otherwise, we won't be able to tell for sure whether or not it was just something that got overlooked, or you weren't sure of the answer and weren't able to find it, versus a definitive no, this does not happen. We also have a place down here in case there's some other services that you would like to discuss. We have 3 places where you can put in your own answers here. Then on the next page, if you contract, and if you have more than 6 contractors, which is what appears over on page 4 there, page 5 will have those additional contractors, and this space will open up as you go. If you do not, this page will go ahead and be blank, and it will have a comment here, this page has been intentionally left blank. So we'll just keep moving on. And please, if you do have any questions, please go ahead and put them in the question section. Okay, so again, we're in the purple section. So we know that we're in the 2013 to 2014 period, 2014 fiscal year. This is where things go back and forth a little bit because of what the legislature asked. So here we're trying to be clear, this is for the school year. We're not asking you to translate your data into the school year. We're going to ask specifically by month so that we can make those match up and not have to have you try to take your year and adjust it. So if you could go through for the month of September of 2013 how many employees did you have, how many FTE did you have, so how many people were there, and then total what was the amount of time they all worked. That would be great. So payroll would probably be a good place to start for some of these numbers. That's why the monthly should work here. We've been told that information is available versus if we'd asked for this annually on the school year, for many people that would have meant having to realign their financials. So this was done to try to make things simpler and more approachable. You can also see that not only are we asking for the number of employees and the FTE, but also the salaries and wages, the benefits, the travel, goods and services, and other. And again, these are totals. So for the month of September, how much was spent on travel in 2013 through August 2014. This form will, you can see these purple sections down here, it will go ahead and start totaling down and across. It does it on its own and is not editable, so you don't have to enter that information. We're just asking for everything in the white. All right, so if we go to the next one.
Jason, this is Laurie.
Yeah.
Can we just clarify what one FTE is? Would that be that's working 52 weeks a year and 40 hours a week?
Yes, thank you very much. Yeah, that's a great. So let's say I have 2 employees, but one of them is half-time and one of them is full-time, so 40 hours a week for the year. So that would be 1.0 FTE.
Yeah, and just to be really clear about that, FTEs are calculated at 2,080 hours a year. So if you don't track FTEs in your organization, what you want to look at is how many hours a year your employees work. And
right.
It's 2,080 hours a year is one full-time equivalent.
It's a good figure to know if you deal with FTEs. So if I have one person who's full-time and one person who's half-time, even though I have 2 employees, I have 1.5 FTE. And people, of course, come in all kinds of increments of FTE. They may work a quarter time, they may work a third time, they may work half the year full-time and then not the other half, in which case they would still be 0.5 FTE. That can come in all kinds of different flavors. Thank you, Lori, very much. Sometimes we get so used to the language that we forget that it's kind of jargony. So on this next section.
And one clarifying, we just did get a question on that slide, so one clarifying point. That first slide is for all of your direct service costs. So we're asking for the number of employees in FTE by month for all of your direct service costs, your providers, the people actually managing and running your programs. We will ask, and we'll show you this in just a moment, but we'll ask for administrative staff and executive leadership on a slide further down, which will represent indirect costs. So the number of employees and FTE is truly for your service and your provider staff and program staff.
Great. I'm sorry, go ahead.
And the other question we got is there is a question around the other category. And the other category, so this is for cost. This is not for funding. We're going to do funding on another page here in a few moments. So what we'd like you to put is your costs for your overall services. So right now we have salaries and wages, employee benefits, travel, goods and services all outlined. But it could be that you have another cost that is for a direct service cost that we haven't represented here. If that's the case, that's what we would like you to program in here. So it would be any other costs that are directly related to services.
And actually, we have one other question in there that is a good question, and I think we'll probably turn this over to Lori and Adrian. The question was, for the FTE, will that include subcontractors? I don't want to answer for them, but I believe that the answer will be no, because they're not your staff, that they will go into salary and wages, but as a well.
No, so if you do have contracts that you're paying, that would be, I believe, in the other category. So if you have contracts for If you're contracting with other providers, the cost of your contracts would be in the other category.
But Lori or Adrian, do you have anything to add to that, or?
No, I think that's correct. That's fine. That's correct.
Okay, great. So these would be people that work for your organization directly, salaries and wages and benefits. Put the contract amounts in other. So other will also include contracting. I might pause here. There is a lot on here, and we're getting some really great questions. So does anybody else have any questions? So we're hearing that maybe the drop-down menus don't work in an older version of Excel. If that's true, you can type in the information.
And actually, so we are aware that in Excel 2007, it may not work the first time you open it. What we recommend is that when you save it to your computer, you save it as a macro-enabled workbook. There are actually no macros in the Excel workbook, but that will solve your compatibility issue between the updated version of Excel and the 2003 to 2007 version of Excel. So if you are having trouble with your drop-downs, what we recommend you do is resave, and Jason's going to go ahead and show you what that would look like.
In fact, I'll do it. Excel 2007 will look slightly different, but you would go to File, and then there's a Save As. It won't look quite like this, but what you would see instead would be a window like this one when you do Save As. And what Annie's talking about is doing a macro-enabled workbook. And if you do that option, it will solve the issue with the drop-downs and they will appear.
Yes.
Yeah, great.
If you're still having trouble, one thing to note is that those drop-downs were really included as a tool to support really efficient and easy use of the survey instrument. They are not necessarily a requirement for completion. So if it's something you'd really like to have access to, and we recommend that, reach out to us via technical assistance, and we can help make sure that you have access to those. But it should not affect your completion of the survey instrument if you have trouble using the drop-down menus for any reason.
Yeah, you can type in yes or no. All right. So I don't think we're any other questions have come in here, but please, if you do have questions, we can go back. Also, we'll be seeing, we're not going to spend too much time in it, but we will be seeing this page again for the next year, for 2014 through 2015. So now we're talking about the direct service costs. This feels pretty similar, right, to the one that we just did. This is also talking about direct service costs, but this is by month. And this is totaled for each of these categories and the number of employees and FTEs. Now what we're talking about is for the year by service. And that's why we're going to use your fiscal year, because our understanding is that that information is much more readily available than the school year would be. So the first column here, we're asking for the number of children that received that service over the course of the year. And then the amount of salaries and wages, benefits, travel, goods and services, and other that you spent on each one of these services. There is a place down here for other services. So if you do provide other direct services, there's a place in the comments, or you can attach a list if you'd like, either way, or even in the submission email about what services those are. But you can just enter that information here. So one thing I want to highlight on here, if your organization does not track travel, goods and services, and or some other costs for these individual services, for the ESIT services, you can enter the total in here. Now, if you enter the total here, then you probably do not want to enter any information down here. So let's say I do that. Say that we spent about $1,500 on travel total. You'll see that this grays out. You can still type in here, but it's going to give you an error message down here. Otherwise, if you do track it by services, for example, you know that PT goes on site, and that's where I spend a pretty significant amount, that's where I would put it. So these top three are in case you do not track those spending categories by service. But for salaries and wages and benefits, we are asking for those by service no matter what, if you can break it down. So children, amount of money, and then this is for your fiscal year 2014. I'm going to just pause for a second. Are there any questions on this? One thing that you'll see is that whenever we say fiscal year, that means your year, whatever you use. Probably, I'm going to guess for many people it might be the calendar year. And then school year will break down by month so that you can provide what the legislature has asked for, but without having to go back and redo your numbers. So far, no questions, but so I'm going to go ahead and keep moving because we're running on time. But please do, and if you have any questions afterwards, please email those in. One thing that I'm not finishing these pages, so the survey progress bar is not updating, but this will start completing as I finish. Because of time, I'm not going to finish a complete page, but what will happen, it's not perfect for every one of these, but it will try its best to figure out if you filled in everything. And there may be times when it thinks you're done and you're not, or it may be times where it thinks you're not done and you are. It's going to do the best with what it knows. And so it'll start filling in and hopefully get to 100%. It's possible. It doesn't have to be at 100% before you submit. Like this progress bar is just to help you know how far you've got, not anything for us.
And the reason it may not be right at 100% is because, again, as we mentioned, ideally we'd be putting zeros in places where the answer is 0 rather than leaving blanks. If you do leave blanks where if the answer maybe is 0, then those are the opportunities to have the survey progress bar not be at 100%. But the survey progress bar is really more of a tool for you than anything else. We find with survey completion, it's helpful to know how far you have gotten in the survey and how much you have left as you're completing it, especially because we know your time is constrained and that this is outside of your regular duties. So that's just a tool to make things easier for you.
All right, so now for the final of the cost screens. So there are 3 cost screens for each of the years, 2 for direct services, 1 based on those services for the annual year, or for your fiscal year, and then 1 of them total cost, not by service, but still just relating to direct services on a month-to-month. Finally, we get to, now this is for the organization as a whole, not just ESIT services, and this is where we'll put in the direct service costs, the administrative functions that were mentioned earlier, and then indirect costs. These can be lumped together. It's the same categories as earlier, where it's employees, FTE, salaries, benefits, travel, goods and services, and other. The white cells are the only place you need to enter. These cells are automatically summing. So this row is a sum of these 2 rows. Same here. Indirect cost is a little different. It may be that you know a % indirect rate for ESIT. If you do have that, you can enter it here, and then just enter the total amount of indirect cost in these particular categories, and it will go ahead and apply that automatically. If you don't know, you can just put in the amount spent on these. And then finally, your total budget, and this is a comment field. If there was any costs that weren't captured above, go ahead and let us know what those were, and we will take them into account. Finally, the last of the purple. Was there something, Annie? No. So the very last of the purple is now about revenue sources. So before it was spending, and this is about revenue. So this one again is by month. So we're trying to get to the legislature school year question. So by month, how much money came in? And so we have a couple different categories here. We have federal, Medicaid, and then other federal sources, which don't need to be specifically identified. And then by month, the amount received in each one of these. You just go across. One thing I want to note, the total is going to look a little funny. There's not quite enough space here, and so it will look correct going down, but if you see these little number signs, it doesn't mean that there's an error. It just means that it doesn't have quite enough space. I think actually if I zoomed out, it would be fine, but Excel can be a little funny like that. So under federal, I have these two categories. Under state agencies, we have Dell, and if you receive any funding from OSPI. Also, if you receive funding from any other state agencies, such as DOH or DSHS, or maybe some others. Then under local sources, this includes county funding, DDE funding, anything that comes from a local government. We also have a place in case you receive funding from a local lead agency. If you receive it from more than one, please go ahead and put that in the comments, which are on the next, in the qualitative section, which is page 14. And then under insurance, we have the private insurance in case you bill military benefits, and then co-pays and deductibles. And then finally, under other, we have fundraising, in-kind donations, and we have a little note here that pops up. However, it's just that if you're unsure of the value specifically of in-kind, go ahead and please approximate. For example, if you are receiving space, the space that you are in as a donation, maybe from a local institution of some kind, school or a college, think about how much you would probably have to pay on the market. Like if you were to go rent a space, how much do you think you would end up paying? And it may be that that's kind of a mystery. It's one of the things you don't have to deal with because you're getting it in kind. So just do your best. This isn't an exact science. And it is also possible that the institution that is donating that, they are reporting it in their taxes. So they might also know if you can send a quick note to somebody in their finance. But like I said, just do your best. This part in particular is not an exact science. We just want to make sure that the legislature understands that the price tag that they see may not include the real price if they're not paying for space or other major expenses. So we want that to be captured. Any funding from private entities or nonprofit organizations, and any fees charged to participants, which we understand probably aren't many, but if you do, and then if you have any others that you'd like to identify. So these gray boxes, the gray text, we're hoping that you'll replace. You can just click and type in. So, for example, DOH, HS, and then I receive all the funding for the year at once. And for DOH and for DSHS, I receive it every other month, you know, that kind of thing, or however it comes in. When you're done with that, you'll see the total down here. That's probably the best check. Your revenue through here should match up with what revenue that you collected between September of 2013 and August of 2014. That's a lot of information, but that is the final of the purple. So that we've gone through cost and we've gone through revenue. The next step of and you can see that it's thinking that because I've entered numbers in here, I've done something with it. It doesn't know exactly when I'm done. After that, everything will turn green. Exact same questions, just a different time period. So this is for the next year. So the legislature asked for numbers for about 2014 school year and 2015 school year. And I can already see a small issue. that these say 2013, and it should be 2014 through 2015, so I will get that corrected. It is entirely possible that we'll have some corrections here. We're going to do our best to keep any surveys going out to a minimum, but that is an error there. So please just respond between September of 2014 and 15 here. But so before I continue on, any was there?
Yeah, so we have quite a number of questions,
oh, wow.
And I want to talk through a couple of things, and then I think one thing that we are finding is that there may be a need for an additional technical assistance webinar around how to adjust your data to put it in to match the construct in this survey. But the first thing I want to say is that we completely understand that this may not be exactly how even any provider or local lead agency tracks their data. We were given very specific requests by both the legislature and our client at Dell about the information that is necessary to be collected, both to align with the information being collected by OSPI, but also to meet the legislature's needs for this study. And so that's the first thing to say, is that we understand that this may not be how you track your data. What we did is we worked with one local lead agency who also had some conversations with some providers to determine if there was any way to collect this that would be feasible. And so just to walk through the purple slides one more time, very quickly, I want to explain a little bit about how we think this might be done, knowing that this does not match exactly to how anyone tracks their data. So the real purpose of collecting this on a monthly basis is that our client has requested this information, and the state legislature has requested this information by school year. And the school fiscal year runs September 1st to August 31st, which I think is not how any local lead agency or provider likely tracks their information. So what we've done to get around that is we're requesting just your monthly totals. So we have broken it up into 4 categories that we think you should be able to pull from your financial statement. Again, we're not saying that you have this information just lying around. Part of the reason that we're providing such a great incentive for completing the survey is that we recognize it's going to take some work to complete it. But the goal is a really important goal, and that's to find ways to improve the ESIT delivery system and to serve more kids statewide. And so we really do hope that you'll bear with us and understand that although this is not exactly how we would like to collect this information, because it doesn't exactly align with how you likely track your data, we've done our best to make something that should be fairly approachable and something that you should be able to complete. So what we recommend here on this slide is looking at your monthly expenses and your financial statements, which most organizations do track on a monthly basis, and looking at the totals for salaries and wages, employee benefits, travel, and goods and services. Travel and goods and services are probably the most difficult because it might require some actual accounting for each month. And so that is one of the things I'd say is that we do recognize it might take some work to get to these totals. And I'd encourage anyone who has any trouble or is taking a lot of time to do this, contact Adrian, and we can work with Adrian to find some ways to make this easier. The other thing is that we probably will do another technical assistance webinar where we provide an example of this. And so I have a couple folks asking questions here, and I'm going to see if one of them may be willing to be our example that we use in one of those webinars. And I'm hoping that one of the folks that has asked some really great questions on here will be willing to do that, so we can provide an example of how this can be done. So the next slide, just really quickly, as we go through this, we actually do think that for your fiscal year, you may be able to pull these by service. One thing that we've heard from our local lead agency is it's actually very difficult to pull individual service level data. It's much easier to pull data by child. We completely recognize that. The fact is the legislature has requested information by service. So part of our exercise with the survey really will be, and we'll show you this in a moment, to collect some information about the challenges around answering this kind of survey. And there's a couple of things that might happen with that information. One is Dell might be able to find some ways to support this kind of on an annual basis, to support this data being something that's always tracked and aligning it to some of the data that you already have to submit to different grantors and to Dell, so that you're already doing this and so this survey is information that you already provide. The other thing is that we may be able to provide some notes about why it's so difficult to provide information in this setup to the legislature, so that when they have future requests, they can make a request that better aligns to the way you actually track your information. But what I would say is that we have pretty limited control over this piece, because this information by service is something that's been specifically requested by the legislature. We have made an effort to make it easier for you by collecting travel, goods and services, and other optionally for the whole year, rather than by service, or for the whole year for all services rather than by service. And we will do the work of allocating that if need be. But unfortunately, we do have to ask for salaries and wages and employee benefits by service. And if that's a real hardship or you're having trouble doing that, please don't hesitate to reach out for technical assistance. We will be able to support that. So I am continuing to answer questions on the question pane. We're almost out of time, so quickly we want to go through the last 2 slides. And we're going to be following up with folks directly, both to see if we can find someone who's willing to be an example for a future technical assistance webinar, and also to make sure that all your questions got answered during today's orientation.
All right, so the second to last page is some qualitative feedback. So in here we have a set of questions. So there are 5 here. Depending upon some information, a 6th one might appear. And so we're just asking about the barriers that you see providing early intervention services, but also the barriers that you have in other places, like accessing other funding sources, also such as Medicaid, private insurance, and then also what resources do you need to expand the services that you're doing, and what barriers do you see there? So this is really kind of just trying to dig in a little bit about what's difficult from the cost side for you. So here's a place where you can provide information in the comments, and you can just type away in here. Excel is not the best for long text. You can copy and paste. You just want to make sure to click in here, and then you can paste the text in there. But I would say that Excel is gently trying to keep us all brief. And so probably want to keep it top level if possible, although we are very curious to hear what you have to say. So finally, can't quite see. There we go. All right. You can see that it's starting to grasp some of the information I've provided. We have just 3 questions here, one of which is optional. Well, actually, 2 of which are optional, but there's a place to say whether or not the survey is complete, whether or not you would like to receive an electronic version of the final report, which will get emailed to the contact email provided on the first page, and any feedback you have about this survey in particular. You can click here to submit the completed survey. It will automatically, again, open in whatever mail program you use. You can also just send that to esit@burkeconsulting.com. Here we just have an overview of the results that you provided. So this is a place where it's taking the information that you have entered and displaying it. You can see that the spending area, because I didn't put much information in, these will adjust automatically as it goes through. So it looks a little funny right now, but it will track them by these 3 sources. The revenue, it has the 5 sources that are outlined as the major categories, and it will display those. And then finally, over the far right, it's just saying whether or not these services, the 17 services outlined, are provided either by you or by a contractor. And so you can see that as I select yes, or I say I do, it'll turn green and say yes. If I haven't answered, it's blank. And unless it's answered for a contractor, but you have contractors, it assumes it is not. So a little quick there at the end, but these last couple should be pretty straightforward. This is mainly just so that you have a place to look. If you get in here and you see the nutrition services, which you know you provide, and it says no, might want to go back and check those pages and make sure that they're answered yes. If not, please reach out for technical assistance. And this is also a place where you can kind of make sure if one of these is $1 million and the other one's 10,000, your revenue and your spending, something's probably out of whack. Maybe one extra zero added somewhere, so you might want to go back and check that. It's just a quick, kind of almost a gut check, I guess you could say. So with that, are there any more questions that?
So there are a couple more questions that we're going to answer individually. I know that we went through this material pretty quickly and that we are over time. So if you have more questions, please don't hesitate to reach out to Adrienne and we'll work with her to make sure those are answered. We'll also be sending out this recording via email no later than Wednesday with the presentation, so you'll have access to that as a resource. And I think that we will discuss if there are if there's more information we can provide about how you might align your data to what's being requested here. Again, we recognize it's a challenge, but we're really responding to the unique requests made by the legislature. As you complete this tool, please don't hesitate to reach out for technical assistance. Our goal is to get as large a response rate as we can so that we have the best information possible. And so we'd really appreciate you reaching out directly to Adrienne so that we can support you in responding to the survey. And also collect your feedback about the survey process so that that's something that we can help share with our clients for future survey processes. We're going to be continuing to respond to folks over the next couple of maybe hour or so. If you do have more questions, though, please do email us. And again, we'll send out these materials no later than Wednesday.
Adrienne or Lori, is there anything that you'd like to add, or otherwise we will go ahead and say goodbye?
I guess the only thing I would add is I'm thinking that we will be tracking the questions so that we can make sure that the responses that we give are consistent.
Yes. Yeah.
And I think also as we get repeated questions, we may have opportunity to send some of those answers out to all respondents so that folks can see it being asked.
Fantastic. Thank you.
This is Adrienne. Did you say you're staying on longer to help answer some individual questions?
So we can stay on the line for another about 8 minutes, but what we were planning on doing is responding to folks via email directly for those folks that we're having some kind of ongoing conversations with. And I think they mainly know who they are, but we will also be documenting the questions from this webinar, the ones that are things that should be shared as responses, and we can send that out with the webinar recording and with the presentation.
That sounds good. I just wanted to make sure I am in the loop on people's questions so I can kind of get a sense of what people are wondering about.
Okay. Well, great. Thank you all very much for your time. We appreciate you joining us today, and we appreciate your time. We realize that this will take resources, but it will help provide the legislature with an answer that will make them make informed funding decisions. And I think we're all kind of hoping that those informed funding decisions go one way, which, well, we'll just keep our fingers crossed. But so thank you. We look forward to working with all of you, and have a wonderful day.